Bleeding disorders may present at birth or develop later in life. The bleeding may be spontaneous or follow trauma or surgery and may be due to defective blood vessels, platelet disorders, or clotting factor deficiency. Past episodes of excessive bleeding, for example, following circumcision, a family history of bleeding, and drug therapy may be important clues to diagnosis. The pattern of bleeding is a helpful guide to its cause. In platelet and vessel wall defects, bleeding is usually into skin and mucosal surfaces like the gums, nose, gastrointestinal tract, whereas in coagulation factor deficiency, for example hemophilia, bleeding is into deep tissues like the brain, joints and muscles. In newborns with vitamin K deficiency, which leads to multiple coagulation factor deficiency, spontaneous bleeding occurs from various sites such as the umbilical cord, gastrointestinal tract, scalp, and the brain. Causes: hemophilia, von Willebrand's disease, liver disease, vitamin K deficiency, especially in newborns, bone marrow failure, for example, aplastic anemia and leukemia, low platelet count from any cause, disseminated intravascular coagulation, that's the IC, from any cause. Also, drug-induced herbal preparations, aspirin, clopidogrel, warfarin, rivaroxaban, and heparin. Also, symptoms include spontaneous bleeding from mucous membranes or cuts, and also easy bruising, bleeding from orifices, excessive bleeding from cuts or incisions, and deformed joints from recurrent joint bleeds. Swelling at the site of blood collection, as pseudotumors, and also pain limiting movement. Okay, so the signs that are usually elicited are pallor, excessive bleeding, localized swelling due to bleeding into body spaces, for example joints, and also tenderness, limitation of movement and joint deformities, and purpura, petechiae, and also ecchymosis. Investigations are FBC, blood film comment, platelet count, liver function test, prothrombin time, INR, partial thromboblastin time, and also bleeding time. Treatment: so the main treatment objectives are to prevent or arrest bleeding, and also to identify and correct underlying cause. Non-pharmacological treatments: apply regulated pressure dressing and ice packs to minimize bleeding where possible, and stop any event or drugs responsible for bleeding or which may aggravate the bleeding, and also educate hemophiliacs on their disease, encouraging them to minimize trauma-prone activities and to inform doctors of their condition before any surgical procedure. Avoid unnecessary injections and also surgical procedures in all patients, especially those with a family history of bleeding tendencies. Physiotherapy on affected joints and also surgery. Pharmacological treatment: general measures as fluid replacement following acute severe blood loss. Sodium chloride 0.9% IV, that's what you give. And also in children you give 20 milliliters per kilogram bolus that, and repeat if there is no clinical improvement, and then you add concentrated red cell transfusion, that's IV. In children, in adults and neonates, to give 3 milliliters per kilogram, for each expected 1 gram per deciliter hemoglobin rise. For bleeding due to underlying liver disease, first line treatment, you give vitamin K IV in adults 5 to 10 milligrams stat, in children 3 to 5 milligrams stat. The neonates, irrespective of history of vitamin K injection, term you give 1 milligram stat, per term you give 500 microgram stat, and also you give fresh frozen plasma IV in adults, children, neonates. You give 15 to 20 milliliters per kilogram. And for hemophilia A, as recombinant factor 8 intravenous. So 1 international unit raises percent of factor 8 on average by 2 per kilogram body weight. Required units is equal to body weight times desired factor rise times 0.5, and is repeated as needed. Or you can give desmopressin intranasal as 150 microgram spray into each nostril 12 hourly, and it may be repeated for 3 days. For hemophilia B, it give recombinant factor 9. Administration of 1 unit per kilogram factor 9 recombinant generally increases factor 9 levels by approximately 0.8% in adults and 0.7% in children less than 15 years of age. Also for 1 Williams disease, you give desmopressin intranasal 150 micrograms spray into each nostril 12 hourly, may be repeated for 3 days. For DIC, that's disseminated intravascular coagulation, you treat underlying cause. Can give fresh frozen plasma. Adults, children, and neonates, you give 15 to 20 milliliters per kilogram, or you give coagulation factor, red cell, and platelet concentrates as needed. And for thrombocytopenia requiring platelet transfusion, you give platelet concentrates in adults, children, neonates. Give 10 milliliters per kilogram. Raises platelet counts by 5 times 10 raised to the power 9 per liter. And also prevention of local fibrinolysis, you give tranexamic acid oral and IV as 100 milligrams per kilogram, and then 10 milligram per kilogram, and in adults 1300 milligrams oral 8 hourly. For second line treatment, for hemophilia A, you give purified factor 8, and can also give cryoprecipitate IV in adults, children, units. You give 1.5 to 2.0 packs per 10 kilograms. And also for hemophilia B, you give purified factor 9 and also fresh frozen plasma. Referral criteria: refer all hemophiliacs and all patients with unexplained recurring bleeding episodes, also those requiring surgery, to the physician specialist or hematologist for initial assessment, treatment plan, and also scheduled comprehensive review.